I think that I can speak from the STD and HIV part. Well, from a lot of different parts. East St. Louis does have a lot of health issues, and it's because of cultural and well, other significant things that variants that take place. But in STD, we have a high STD rate and a high HIV rate, which actually brings a lot of attention to East St. Louis, which is a negative attention. But what's positive about it is that we have public health in the midst, the local public health department, and we have been actively working against the trying to bring the HIV rate down. There's a lot, the poverty, aesthetically, when you look at East St. Louis, you don't see a lot of good things, but having been reared in East St. Louis was at one time a very nice looking community and everything. It's just like a lot of other communities that have been scarred by recent developments, you know, the drugs and the loss of jobs. So it's a community that's showing those kind of signs. In showing those kind of signs, there's more stress in the community because of lack of jobs and everything. There's more stress, even in the school district. The kids don't learn as well. The teachers don't teach as well because of some of the issues that's facing East St. Louis. But what I do notice about East St. Louis also is that it's garnering a lot of attention, just like you all are here. Yesterday we had visitors that came in to check out some of our programs here also. And so as attention is being drawn to East St. Louis, we'd be able to get some more support to be able to change some things. But there's a lot of health issues and a lot of disease issues, a lot of the economical issues. East St. Louis has all of those, and probably more.
Well, I can also kind of add to that economically as it relates to hypertension,
Yes.
diabetes. We have a lot of children that are obese. A lot of that is attributed to the way in which you're reared, how to prepare your meals, and a lot of it kind of stems from culture.
Right.
Our culture, we believe in seasoning our foods, and we believe in putting a lot of fat to our foods. So all of those things is a mixture of the culture as it relates to why we have such high obesity rates, why we have high hypertension rates and diabetes rates as well. And a lot of times, as it relates to our particular area, we do get a lot of resources that we can kind of tap into. We get a lot of information from the hospitals and things of that nature where they come in and try to do a lot of their research to bring more support and more resources. And we also try to seek out additional grants that can assist those particular areas, because public health does not pay for everything. So we, as the local health department, have to seek out additional grants to target those particular issues.
And I would just like to say that one of the biggest issues that I see, especially working with the adolescent population, is access to care. And it's not because it's not there, it's because, like Ross said, it is a cultural thing. That even though it's there in the community, preventative health is not something that people do on a normal basis. We'll take care of it at home, we'll do old remedies, we'll do stuff. So it is a lot about educating. And that's one of the reasons that I like working for Eastside Health District, is because it's community health education. And for Adolescent Health Matters, it's really important to teach the young people how to take care of themselves, so that then they can go back into the culture and teach the older people, okay, this is the new way, this is technology, this is what we need to do to make sure that we stay healthy.